Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. A mode, B mode and the Doppler. So this is what we'll be covering. So in case of A mode, it is the axial length of the airball. So it is nothing but the axial length of the eyeball. Next, moving on to the B mode. What is the B mode? B mode is nothing but the routine ultrasound. It is a routine ultrasound. Next is moving on to the Doppler. So under Doppler, it is the vascular pathology. So this includes there is presence of PVD, there is presence of arterial stenosis, as well as there is varicose vein. So varicose vein is seen. Then comes the DVT, the portal hypertension, the renal artery stenosis, as well as the carotid sinus, carotid stenosis. To learn and grow daily like this, please do subscribe.